keep seeing these videos where some doctor is walking in Miami and they get interviewed by a street interviewer, and the question's like, hey, is it still a good idea for someone to become a physician? And almost always they say, no, I wouldn't recommend it to my kids for X, Y, and Z reason. To be honest, the reasons they list are usually true, especially with the loss of autonomy, because nowadays doctors really don't run the show. They're usually owned by hospitals or private equity and whatever else. However, I do have to say that if you get creative with what you do as a physician, the career is better than ever. In the last month, I've looked at maybe 1,000 people's LinkedIns that are all physicians, and I just wanted to see what things they were doing on the side besides just being a physician. A lot of doctors are getting involved in things outside of just seeing patients and things outside of doing research at an academic institution. So for example, and probably the area I'm personally most excited in, a lot of doctors are helping medical startups. Now, their role, whether you want to believe it or not, is crucial, because if you're a startup trying to develop a product that's centered around making doctors' lives easier or making the hospital flow better, the doctor's perspective, although you as a physician might not think it's anything special, is truly something they need to hear. For example, if someone's coming up with a new sort of technology that's being integrated in the EMR, whichever one you use, and you as a doctor would be like, yeah, that's a good idea, but dude, that would take me 15 minutes to pull up this program, another 15 minutes to put in these variables. Like, do you realize I have to see a patient every 10 minutes? This would never work in the real world. That's just one example. But the doctors that do get involved in startups make a side career or even a main career out of that. Because again, when you're working for startups, if you're doing it right, if you negotiate correctly, if you have the right team behind you, the ceiling is infinite. All of this is to say that, like, there are more career opportunities than you think than just being a doctor who sees patients, or just being a doctor who's at an academic institution having to apply for research grants. Like, truly, 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 there's so many interesting things that you could do to make a living.